There is new evidence tonight that fracking is far more dangerous in the short term than previously thought.
And dangerous for far more people. The Colorado Department of Public Health says it has research showing there is a higher risk for nosebleeds, headaches, and dizziness to people living within 2,000 feet of wells in worst case scenarios. Now, the current minimum setback for Colorado homes is 500 feet. Context 7 investigates. Jennifer Kovaleski is our resident oil and gas expert. And Jen, there is a bright spot here.
Shannon and Ann, the same study also finds no elevated risks of cancer or long-term health effects from oil and gas. In rare circumstances, it finds those short-term impacts like nosebleeds and dizziness.
We published a modeling study entitled Human Health Risk Assessment for Oil and Gas Operations in Colorado.
An oil and gas risk assessment causing uproar. The new study finds no long-term health impacts linked to oil and gas wells within 2,000 feet from homes. It finds potential, but rare.
There may be a risk of short-term health effects from oil and gas emissions.
An exposure to chemicals like benzene, symptoms like headaches, dizziness, and nosebleeds. The study uses emissions data from 2016 and is based on computer modeling.
This study confirms prior research as well as our findings out in the field that there's not an enhanced level of cancer.
The Colorado Oil and Gas Commission says it's taking immediate action. All pending well permits within 2,000 feet from houses will now face greater scrutiny. COGCC says that means 39 pending permits will undergo further review.
We should take a hard look before we approve new wells within that realm.
As for existing wells within that distance in the pre-production phase,
I will reach out to those operators to see if we can work with them.
The state says the study reinforces what it already knows. It needs to minimize emissions from oil and gas. The Colorado Oil and Gas Association, who represents the industry, calls much of the study positive.
Bears out what we've said, and there are no long-term impacts to health for people in Colorado who live near oil and gas.
The industry also says technology has changed drastically and wants to see actual data dictate policy.
Policy needs to be based on real data, actual data, not modeling, not hypotheticals, not theoreticals.
Here's the bottom line. The state says this study shows the need for more testing. The director of the COGCC told me that's his biggest takeaway from this. His organization will now use its own money to conduct this testing at wells across the state. Ann?